Hello everyone, welcome back to my channel. Today, we'll do a rapid review of 100 key respiratory system conditions and definitions. This video is designed for quick revision, helping you memorize high-yield terms commonly tested and used in pharmacy and respiratory system diseases. Asthma, chronic inflammation causing airway narrowing. Bronchitis, inflammation of the bronchial tubes. Acute bronchitis, short-term bronchial infection. Chronic bronchitis, long-term mucus-producing cough. Pneumonia, infection of the lung air sacs. Tuberculosis, bacterial lung infection. Emphysema, damage to lung air sacs. Chronic obstructive pulmonary disease, long-term airflow limitation. Influenza, flu, viral respiratory infection. Common cold, mild viral upper respiratory infection. COVID-19 viral infection affecting lungs and airways. Whooping cough, pertussis, severe bacterial cough illness. Croup, viral infection causing barking cough. Bronchiolitis, inflammation of small airways. Laryngitis, inflammation of the voice box. Pharyngitis, inflammation of the throat. Tonsillitis, inflammation of the tonsils. Sinusitis, inflammation of the sinuses. Allergic rhinitis, nasal inflammation due to allergies. Non-allergic rhinitis, nasal inflammation not caused by allergies. Hay fever, seasonal allergic rhinitis. Nasal polyps, soft growths in nasal passages. Deviated septum, displaced nasal septum. Epistaxis, nosebleed. Sleep apnea, breathing stops during sleep. Obstructive sleep apnea, airway blockage during sleep. Central sleep apnea, brain fails to signal breathing. Pulmonary fibrosis, scarring of lung tissue. Pulmonary edema, fluid buildup in lungs. Pulmonary embolism, blood clot in lung arteries. Pleurisy, inflammation of lung lining. Pleural effusion, fluid around the lungs. Pneumothorax, collapsed lung. Hemothorax, blood in chest cavity. Chylothorax, lymph fluid in chest cavity. Lung cancer, malignant tumor in lungs. Small cell lung cancer, fast-growing lung cancer. Non-small cell lung cancer, common lung cancer type. Mesothelioma, cancer of lung lining. Asbestosis, lung disease from asbestos exposure. Silicosis, lung disease from silica dust. Anthracosis, coal dust lung disease. Hypoxia, low oxygen levels in blood. Hypercapnia, high carbon dioxide levels. Acute respiratory distress syndrome, severe lung failure. Respiratory failure, inadequate gas exchange. Atelectasis, partial lung collapse. Interstitial lung disease, diseases affecting lung tissue. Sarcoidosis, inflammatory lung disease. Pulmonary hypertension, high blood pressure in lung arteries. Bronchiectasis, permanent widening of airways. Cystic fibrosis, genetic disorder causing thick mucus. Alpha-1 antitrypsin deficiency, genetic lung disease. Viral pneumonia, pneumonia caused by viruses. Bacterial pneumonia, pneumonia caused by bacteria. Aspiration pneumonia, inhalation of food or liquid into lungs. Chemical pneumonitis, lung irritation from chemicals. Smoke inhalation injury, lung damage from smoke. Respiratory syncytial virus, viral lung infection in children. Avian influenza, bird flu affecting lungs. Middle East respiratory syndrome, MERS, viral respiratory illness. Severe acute respiratory syndrome, SARS, serious viral lung infection. Upper respiratory tract infection, URTI, infection of nose and throat. Lower respiratory tract infection, LRTI, infection of lungs or bronchi. Tracheitis, inflammation of the trachea. Tracheal stenosis, narrowing of the trachea. Foreign body aspiration, object inhaled into airway. Vocal cord paralysis, loss of vocal cord movement. Dysphonia, difficulty speaking. Hoarseness, rough or weak voice. Chronic cough, long-lasting cough. Acute cough, short-term cough. Hemoptysis, coughing up blood. Dyspnea, difficulty breathing. Orthopnea, breathing difficulty when lying flat. Paroxysmal nocturnal dyspnea, sudden nighttime breathlessness. Hyperventilation syndrome, excessively rapid breathing. Hypoventilation, inadequate breathing. Respiratory alkalosis, high blood pH due to rapid breathing. Respiratory acidosis, low blood pH due to poor ventilation. Neonatal respiratory distress syndrome, lung immaturity in newborns. Bronchopulmonary dysplasia, chronic lung disease in infants. Pulmonary hemorrhage, bleeding into lungs. Lung abscess, pus-filled lung cavity. Empyema, pus in pleural space. Airway obstruction, blockage of airflow. Laryngospasm, sudden vocal cord closure. Tracheomalacia, weak tracheal walls. Bronchomalacia, weak bronchial walls. Hypersensitivity pneumonitis, allergic lung inflammation. Occupational lung disease, work-related lung conditions. Farmer's lung, mold-related lung disease. Byssinosis, cotton dust lung disease. Ozone-induced lung injury, lung damage from pollution. Smoker's lung disease, lung damage from smoking. Second-hand smoke exposure, lung damage from passive smoking. Altitude sickness, breathing difficulty at high altitude. Pulmonary contusion, bruised lung tissue. Chest wall restriction, limited lung expansion. Respiratory infection, disease affecting breathing system.